Dr. Qingxin Huang from Tzu Northwest Medical Team. Today this video is for orientation on sterilization procedures in dental van, 大爱 dental van, and also Tzu outreaches. Volunteer and be at the sterilization station. We really want you to help yourself, protect yourself first. So the personal protective equipment are very important. First, please make sure you wear water-resistant gown. Cover your eyes. Wear your mask. The color side should face outward. And then the nose area be pitched so it's well fitted. Please wear protective gloves that fits your hand size. If someone wear a loose glove, you tend to have harder time to grip instruments. Thus, you can cause injuries, you can drop things. Receiving instruments. Upon receiving contaminated patient-used instruments, it is very important that there are many different instruments on the tray. We have to observe our field of work area. So if we're in charge of the sterilization area, we have to make sure this is the waste area. This is where all the dirty instruments coming in. This is where we're gonna process our sterilization and until this autoclave, the sterilizer. After the sterilizer, then all the instruments are considered to be clean. They cannot go back to this table set anymore, the bench area. First, I would like to remove all the waste from the tray. It is very important to use either a cotton plier or a hemostat to help you. Because when the patient's, the treatment tray comes sometimes with gauze, with blood, with cotton rolls, also with the small sharp instruments inside. It is important to sort everything out first. First, you should remove gauze and then dispose them. If the gauze has blood on it, but does not soak the whole gauze, it is considered regular waste, then can go into trash. If a gauze is dripping blood, is very soaked with blood, then it should go into the biohazard. Second is the sharp instrument. For the syringe holder, it is important to note that the syringe, and there is a holder at the tip of this syringe. You should hold down to the plastic needle hub and turn in order to remove the needle. Please note to do all the procedure on top of the bench so you don't drop them on the floor. And then safely wiggle and remove the needle, straight go into the shot. If you feel any resistance, if there's any tightness during this procedure, that means do not use any force. Otherwise, you will injure yourself with the needle. If you cannot remove the needle, please ask volunteers or the volunteers in charge of the day. It is important that we separate the instrument at this point. There are small burrs that sometimes get caught with the gauze and cotton roll. There are also expensive instruments like piezo cleaner that get caught, so they need to be separated. And then they can be cleaned and placed in small cassettes like these, so they won't be lost. After you remove the infectious biohazard material and sharp, also remove the extracted teeth should go into the biohazard bag also. If a tooth has amalgam in them, means the silver fillings, that should go into the amalgam disposal. If a gauze or a cotton roll is stained with amalgam while tooth drilling thus is gray, then that should go into the amalgam disposal too. Lastly, there's the lidocaine, also all the anesthesia carpio that fits into the syringe, aspirating syringe. If there's any remaining pharmaceutical material, means that there's remaining medicine, then it should be taken out and disposed into the sharps container. If the whole carpio has been finished, please dispose it into the trash can. The next step is to clean up the instruments, because when the instrument have been used on patient, there's biological debris on them. For instance, blood, plaque, and calculus, they're full of bacteria, so they need to be processed and cleaned before the instrument can be sterilized. First, please wear the utility glove, because all the instrument comes in various shape and they're always sharp. We want to protect our personnel from being injured. There are 3 ways to remove the debris from our instrument. First, we will soak the instrument in diluted bleach solution. Soaking can soften the biological debris from the instrument. Second, we can do manual scrapping. Please pay attention on the working end of this instrument. The third step to remove biological debris from the instrument is by the ultrasonic bath. First, please fill the ultrasonic bath with water until the indicated holes on the basket. Second, you use 2 tablets per event. If the event consists multiple instrument processing, it is you can try to make a new batch of ultrasonic solution if there's too many instruments. Second, you can transfer the instrument with this basket to avoid any injuries. From the bleach solution, you first rinse off the bleaching solution from the instrument, and then you can transfer into the ultrasonic bath. Make sure we cover this bath, because then the biological debris wouldn't be spreading everywhere. Make sure when you fill the solution, the faucet for the bath is turned off, is closed underneath the sink, and also we turned on the ultrasonic bath for 10 minutes. Okay. After ultrasonic bath is finished, make sure we have this basket filled with distilled water, because we want to rinse off the ultrasonic solution off the instrument. Over time, all these solution will create deposits on our instrument. We want to make sure every step is well rinsed off. You're handling all the instrument now without utility glove, because you wouldn't be contacting the instrument directly. And then here, this is a distilled water soak. After the distilled water soak, you can then transfer. Pay attention that I'm not holding the instruments by my hand. You need to dry these instruments and properly baggage them. Before the instrument goes into the sterilizer, we need to sort these instruments per procedure. And then they should be dry, because when we're using steaming sterilization, the sterilizer can only dry off the steam that it creates from its machine. If you have excessive water on these instruments, then the sterilizer won't dry them efficiently. Then you need to arrange your instruments according to their use per procedure. For instance, this setup is for exams. Then we use the pouch that is sized accordingly, so we're not wasting space. And make sure we seal the pouch all the way through. On these sterilization pouches, there are indicators. When the indicators turns brown, from pink to brown in this brand, that means the sterilization is completed. We need to use pouches that fits the instrument. Do not use unnecessary force. To be safe, always utilize hemostat or cotton pliers or tweezers. So these instruments are ready to be processed. First, before we process our instrument, before the day starts, make sure our sterilizer has enough of distilled water. When you load the instruments, make sure you do not overload the sterilizer. And the paper side of the pouch face up so that it can be properly dry after the procedure. Now the sterilization process is finished. You need a different set of gloves, a clean set of gloves. As we discussed before, all the instrument process starts on the bench top to the sink. This is considered working area and is not sterilized. But once the instrument coming from the sterilization machine, it is considered sterile. So you cannot use the same glove you used before, nor with bare hands. Now I'm removing. It is hot, so please do be careful. And then I am going to a different bench area to sort my instrument. Note that the indicator on the pouches has turned brown. That means the sterilization process is completed. So I will sort these instruments according to cleaning, surgery, and also for restorative, composite, and amalgam. Lastly, for special instrument treatments, we have high-speed handpiece and we have low-speed handpiece. We have cabochon tips. Because these machineries, they have motor inside, and also the cabochon handpiece has water coming through them. So we do not soak these instruments nor place them in the ultrasonic bath so that they can be used, the instrument can be used longer. First, we have to lubricate the motors on the handpieces. Know that there is a bigger hole and a small hole at the bottom of this handpiece. We will spray oil, motor oil, one spray in there. And then to lubricate the motor, we recommend to use the chair side handpiece, the line, and run the air without water through the handpiece so that the oil can lubricate the whole handpiece evenly. And the outside of the handpieces, we need to remove all the debris. Same with cabochon tip. And then these instruments are ready to be packed. When we pack the instruments, make sure that the working end is facing, is at the bottom, so that the taping area doesn't cover the working end. So we see what the instrument is being pouched.